So while rice, rest, ice, compression, and elevation are all beneficial in reducing pain, sometimes they don't give us the best outcomes long term. The concept of rice came from actually trying to actively return athletes to play. So in sports medicine, one of the goals, oftentimes, not always, but oftentimes, is in the research is how do we get that athlete back into play? There tends to be less of an emphasis on long-term consequences and long-term rehabilitation. So while rice, rest, ice, compression, and elevation are all beneficial in reducing pain, sometimes they don't give us the best outcomes long term because injuries need rehabilitation. And let's talk a little bit about why that is. When you damage muscles, tendons, ligaments, they tend to be very slow to heal. The reason being is that they have low blood supply. And remember that your blood is really a big part of how you heal in your body, right? If you cut your skin, if you get a paper cut, it bleeds, platelets come in, they form a clot, and that is what starts that healing process in the body. Well, when we don't have a good vascular supply, we don't heal as well. And so oftentimes these tendons, ligaments, muscle injuries take quite a long time to heal. But there's several things we can do. First is those initial stages of inflammation can be healthy. Now they can also be overdone, and occasionally we do need to suppress them. But for the most part, that initial inflammation in that first 48 to 72 hours, that inflammation is often beneficial. So then what we want to do is let that inflammation take place. It's uncomfortable, and I know it, but that is your body's initial response to that injury. So then, after that, what I like to do is, even during that initial stage, is some very, very gentle osteopathic manipulation. Now, the focus on the manipulation at this stage isn't on getting bones back into place, it's actually on restoring the proper function of the tissues. Oftentimes, that's one of the first things I'm looking for at this initial stage of rehab, is just getting the tissues unfrozen and getting them moving again. So typically I'm not popping joints or doing anything aggressive like that. It's usually a very light touch focused on restoring those tissues so that all of those inflammatory products that are there to heal can drain properly. Because you see what happens is we have an influx of all of the healing properties of your body, all of the blood products, all of this inflammatory cascade, and all of that starts coming into the injured area. Now, yes, the area swells up, it hurts, it gets stiff, it gets sore, and that is beneficial, and we want that to take place. But we also don't want it to become a stagnant swamp of inflammatory products, because then at that point, now we're hurting without getting any benefit. So it's not just that we want all this inflammation to come into the area, we also want to make sure that it can drain. We also want to make sure the area can move. Because remember, with every breath that you take, all of the tissues in the body are moving. And that does perform a pump-like action to help drain out and flush out those inflammatory products. So we want to not just let that inflammation take place, we want to drain the area. As that process unfolds, sometimes patients are having a fair amount of pain and discomfort, and it can be quite uncomfortable, especially if we're not taking things like Advil and Motrin. Acupuncture can play a big role in helping to manage pain. We know from research that acupuncture plays an effect on increasing blood flow. We know that it alters the tissue planes, it helps the area to drain, gets those inflammatory products out when they're done causing their beneficial effect before they start to build up and actually make things worse. But it also changes the chemicals in our brain, and it helps us with our pain modulation. So a lot of benefit from acupuncture in this process. As we go through the process, sometimes we just simply don't have enough blood flow to get good rehabilitation to the area. And at that point, we need to look at going into something like prolotherapy or PRP. We have several videos on those, but basically what that is we come in and we augment the inflammation. Because remember, as we age, with our diet, with our lifestyle, with many different things, our inflammatory response, oftentimes we have some bad inflammation that gets played, we have too much of it. And then the good inflammation, the healing inflammation, ends up being suppressed and inadequate. So we need to suppress the bad inflammation and we need to augment the good inflammation. And we do that with prolotherapy and PRP, depending upon the nature of the injury. And in those two procedures, we come in and we inject a substance into your body to augment your body's own natural inflammatory response to help the tissues to heal. Now, just doing those regenerative injections like prolotherapy or PRP oftentimes isn't sufficient. It is beneficial, but we need to continue with the manipulation, sometimes with the acupuncture, in order to get an ideal response. Because again, just fixing the ligament, if the tissues are still stuck, doesn't provide much benefit. In fact, you may have heard about people that had prolotherapy or PRP, and not only did the tissues flare up, but they got worse and it stayed worse for a period of time. Oftentimes it's because we didn't have adequate preparation in that area for the body to properly deal with the inflammatory response that was created with the injection. And so that's how we start to use acupuncture, manipulation, and the injections together. But another key part of that is we also have to look at the total health of the individual, because all of these treatments are based on the idea that your body has the ability to heal itself. And really my job as a physician is to help augment that process. That process should be able to take care of most things. It's our diet, it's our lifestyle, it's the traumatic events that aren't properly rehabilitated that really get into the way. So we want to find those barriers to health and help you remove them. And so looking at things like hormone levels, at your sleep, at your stress, at your diet, all of those play an important role in making sure that your body has the resources that it needs in order to mount a good healing therapeutic response.